Hello, I'm Barbara Firth, and this presentation is about learning from child and adult practice reviews. The aim of this short presentation is to identify and explore the learning from both local and national adult practice reviews, child practice reviews, and multi-agency forums. This will be followed up by seminars in National Safeguarding Week, which will offer you an opportunity to reflect on this learning and to think about how to integrate it into practice and systems. So this is all about disseminating learning. As you watch this video, think about whether the identified themes resonate with you and your role and your remit. I'll start by explaining what I looked at. So I said I looked at reports on a national level and at a local level. At a national level, they were thematic reports, and there were three that I looked at. There was the first one was a Public Health Wales National Safeguarding Team, which did a review and child practice reviews, adult practice reviews and domestic homicide reviews, and that was between 2017 and 2018. So they did a snapshot of a year, and there were 12 reviews that they were looked at, 2 DHRs, 5 adult practice reviews and 5 child practice reviews. Then Cardiff University did 2 thematic analyses. The first was into adult deaths in Wales, and that was published in March 2018. And they looked at 20 reviews. Of those, 10 were DHRs, 6 were adult practice reviews, and 4 were mental health homicide reviews. And then the third thematic analysis, again from Cardiff University, which was published in February 2020, looked at a total of 20 child protection reviews, child practice reviews, that were completed between 2014 and 2019. So those were the national reports. At a local level, I looked at multi-agency professional forums, child practice reviews and adult practice reviews. Multi-agency professional forums, just to remind you, they're part of an ongoing programme of learning and development, and it's situations that might not quite meet the criteria for a practice review, but it's felt that there could be some learning from them. So there were 7 of those that I looked at. 4 about children between 2017 and 2018, and 3 concerned adults, and that was for the year 2018 to 2019. Then there were 6 2019. 4 of those were concise and 2 were extended. And then 2 adult practice reviews from 2016 and 2020. 1 was concise and 1 was extended. So it's a wide range of reports that I looked at, but as I looked through those, what really struck me was something that was highlighted in the triennial analysis of English serious case reviews that was published in March 2020. And it was this underpinning theme of complexity and challenge. The complexity of the lives of the children, the families and the individuals who were subject to the reviews, and the challenges, at times quite overwhelming, that were faced by the practitioners seeking to support them in such complexity. So that underpinning theme of complexity and challenge came up time and time again. Some key themes then that I identified, and there were 9 in total, and I'm going to go through each one of those. So these are what they were: things about crossing boundaries. The second one was hoodwinking or disguised compliance or unwillingness to engage. The third was around shortcomings in assessment. The fourth was about understanding and appreciating the lived experience of the child or the adult. The 5th one was information sharing and interagency communication. That comes up all the time. We'll say more about that later. Then hierarchy of knowledge. It's an interesting one. And then two that again keep cropping up and are a little bit in danger of becoming buzzwords, and that's professional challenge and professional curiosity. And then the final one was the importance of supervision. So I'm going to go through each of those in turn and just say a little bit more about what emerged from the report. So let's start with crossing boundaries. Now, this can be geographical boundaries, when a family or an individual move from one area to another. We know that that happens. It could be crossing boundaries from one service to another, or again, that really thorny area of transitions, that boundary from child to adult services. So three sorts of boundaries. And what's clear is that when boundaries are crossed, things can get lost. We can lose families, we can lose individuals. They go off the radar for a time, or maybe for a long time. They go missing, so we lose them, and all our concerns about them, we can do nothing because we've lost them for the time being. We can lose key pieces of information, key data about a situation. That if some information doesn't follow families, that might be things to do with IT systems. It might sometimes be human error, just things getting lost. So we lose information. But we can also lose the meaning behind that information. And by that, I mean our analysis of a situation. What made us concerned in the first place? What are the risks that we spotted? But as it crosses a boundary, that might not be understood in the same way by the person receiving that information. And so a referral might not be accepted because it said, oh, this doesn't cross our threshold. That, I think, therefore, is linked to how we record things and how we clarify what the causes of concern are. And again, that will come up later. So the meaning behind the information can sometimes get lost. A family or an individual might lose services, and we see that sometimes in the transition from child to adult services, for instance, because thresholds are different, eligibility criteria is different, or the placements aren't available to meet the needs of a young adult who's moving from childhood into adulthood. So a lack of placements or a different sort of placement. So when there is a boundary, there is a danger of things becoming lost. The third theme was about hoodwinking or disguise compliance or unwillingness to engage. Just a little word about hoodwinking. That was a term used by the Cardiff University Thematic Analysis of Adult Deaths. And if you look at a dictionary definition, hoodwinking means to cheat, to deceive, to blindfold, to hoodwink. But all of those things are facets of the same issue. It's all about not being able to genuinely connect with an individual or family in their situation, of being prevented from providing the appropriate support to make changes in a situation. So when we look at hoodwinking, there are examples of it relating to individuals disguising or manipulating their presentation of self, for example, to appear more benign, or that they were better able to understand things than they, or better able to do things than they actually were. And what that can do is lead to professionals underestimating the level of risk. So there are examples, for instance, of when there are maybe allegations of domestic abuse, that hoodwinking going on, and so professionals recording it as marital and relationship difficulties, when actually it was at a much more serious and risky level than that. Or maybe that professionals then assume that things are happening when they're actually not. And there's an example in a recent adult practice review of residential staff saying, yes, we've taken this person to all the activities in her care plan. Actually, they hadn't. They'd been locking her in her room. So hoodwinking. Then we've got disguise compliance. And again, that's been quite a a mantra in children's services, and that's when families and individuals appear to be cooperative, appear to comply with interventive plans, but actually they're not. They're just not doing it. And then that third theme of individuals and families being unwilling or reluctant to engage with professional systems and services. And when that happens, the focus of professional activity becomes one of trying to make contact with them, trying to get them to attend an appointment or be in for a home visit. So that's where energy is focused, and any meaningful assessment or intervention plan, it's put on hold because you just can't get to them to do anything. And then there are cases of what I call the professionals surrendering and just closing the case because they just can't get anywhere. The common thread in all of that is about families and individuals wanting to keep professionals out of their lives. Just go away, don't come near. And it leaves us with some questions to think about. How do we check out what people are telling us? How do we challenge appropriately? And how flexible and creative can we be in making connections with individuals and families? It's difficult stuff. The next theme is about the shortcomings in assessment. And again, that's something that does come up in lots of reviews, and sometimes couched in the way that, you know, professionals, the assessments were rather shallow, they're not in depth. But what for me this points out when there are shortcomings is the complexity of people's lives and the challenge for professionals in trying to truly understand what is happening for families and individuals, and therefore how best to support them. But these are some of the points, therefore, that came out of the reviews. Some assessments having too narrow a focus, so just focusing on one issue, one problem, perhaps a concentration on the most doable and the most tangible. And you can see why that happens, because given that complexity, given workload pressures, given the pressure as well to move a situation on, it's professionals are left with, well, what is it we can do? We'll focus on what it is that we can do, and all those other issues we just can't get near to tackling at the moment. Linked to that point is about assessments concentrating on individuals without due regard to their context, their network, and their relationships, their links and connections. In other words, it's about assessments not being sufficiently holistic. And people do have very complex connections with one another that really impact on how they live their lives. How do we understand that? How do we find out about it? It's not easy, not easy. So we've got to think holistic. We've got to think about what their links and connections are and what their context is. The next point is about sometimes being over optimistic about the coping skills of individuals and families in the longer term. So for instance, people being discharged from a service when they're doing well, but then it's only for them to fail a little bit further down the line. Think about neglect. That's happened in neglect. We put lots of services in, we put lots of support in, and families improve. And sometimes it's at that point that, you know, the case is closed or services are withdrawn, and then in a short time people start not coping again. It's that phrase, bumping along the bottom. So what we need to think about is how we gradually move from that, if you like, feast to famine. But how do we assess people's capacity to sustain that improvement and progress in their lives? So it's about their capacity to sustain change. And that means that when they're doing well, that's not the time to withdraw. That's the time to stay there and look at how they might manage that in the longer term. The next point is about a lack of analysis in assessment, so a concentration on incidents rather than that taking that long view and trying to identify and assess patterns of behaviour. So sometimes an over concentration on incidents. I think the next point's really important. It's about the role of professional instincts and feelings, often dismissed and often overlooked. Now, I know we cannot work on that alone, but I call that practice wisdom, because when we have an instinct, when we have a feeling about something, it doesn't come out of the blue. It comes from somewhere, and we need to recognise that and explore it and try to evidence it. So don't ignore it. It has a place. It has a place. It's also saying about the perceptions of individuals and families about assessments and being assessed. And some saw it as a test that had to be passed, and therefore were not as open and honest as they might have been. So, you know, it's that disguised compliance, all of that comes into play again, but seeing it as a test, and if they fail that test, then it might have an adverse impact for them, and indeed it might. They might lose their children, as it were. They might be deemed they do not have the capacity to make their own decisions, so there's a loss for them sometimes as a result of an assessment. And the final point, there is no reassessment of care plans. But actually people's situations are fluid and dynamic. They change, their needs change. We need to keep going back and reviewing that. The next theme was about understanding and appreciating the lived experience of the child or the adult. In children's world, we used to talk about the voice of the child a lot, but I think it's a more helpful phrase to think about the lived experience, because some children, some adults can't express their feelings, their views. What we do know, and what came out of the reviews, is that the problems experienced by parents can dominate, and that can render the child or children invisible, because they're very much the fore of the parents' issues and problems. And then again, we see with adults who have problems in communicating, they can become in a way peripheral to that system, to that assessment. And planning, and assumptions made about what they need or what can be provided. People are concerned about them, but they are not involving them in that process, perhaps in the way that they should. So it's important to consider, to understand and appreciate their perspective and their lived experience, even if for whatever reason they cannot articulate their views and wishes. So that means face-to-face contact, listening, observing, and providing an opportunity for expression of those feelings, views and wishes. And it is, from time to time in the work we're doing, it's saying, I wonder what it's like to stand in their shoes. What must it be like for this child in this family? What must it be like for that elderly man in that residential placement? So stand in their shoes. The next, information sharing and interagency communication. I think every review that's ever been written, this pops up. But it's not a case of professionals just being a bit lazy or can't be bothered to talk to their colleagues. As with everything, it's much, much more complex than that. And this is what emerged from all of those reviews I've just looked at, that professionals are sometimes unsure of the rules of information sharing, and they are complex, and we've got GDPR and all sorts of things. So it's not an easy area, this, and there are some particular difficult things, like when can information be shared without consent. So a confusion still about what we can share and what we can't share. What are the rules? Then we've got different IT systems, and that can really serve to complicate information sharing and communication, and who therefore has access to what system and therefore access to what information. It can make huge impact on a situation. So IT systems, where they can be brilliant in terms of facilitating our communication, can also make it complicated as well. A lack of understanding of each other's roles and remits can affect information sharing, that not being aware of what people do and therefore they need to be part of this work or part of the information loop, or they've got information that will be helpful to you in the work that you're doing. So we need to really understand who's out there and what it is that they do. There's also inconsistent language across agencies that can affect communication. If you like, professional jargon, and we've all got our own professional jargon. And so therefore some words that have certain meanings to us may not have the same meaning to a colleague in another agency. So as we're communicating, we need to be checking things out. We don't make assumptions that we are understanding things in exactly the same way. You need to have the right people at meetings, multi-agency meetings. That's absolutely crucial. There was a theme sometimes that if an agency had got a closed case, then they weren't invited to a meeting or they didn't go to that meeting. But actually, they had some really important historical information, and they also would have had a perspective on that situation, what would have been helpful to everybody. And then finally, that final point is about, there are a lot of situations where there are lots of professionals involved in some way or another, and so the need for coordination, so you're not duplicating work. And if lots of people are visiting someone, you're coordinating when that happens. So you're not all going in on the same day and then they're not being seen for 3 weeks. So coordination is a very important word there. Then I'm coming on to these next two themes that are in danger of becoming a bit of a meaningless buzzword. So we're going to make them meaningful. Oh no, we're not. I haven't got to that bit yet. Apologies. The next theme is the hierarchy of knowledge. And this is about who is listened to and why. And I think this is really quite interesting and important. So what we do know is that the views of certain professionals can take precedence over the views of others. They're seen as more knowledgeable, they are experts, they're seen as experts. So what they say carries more weight than what other people say. And then there's something about the decisions and views of professionals. They're seen as being based on objective knowledge, and therefore they're superior to the subjective judgments of paraprofessionals and of family and community members. So they take precedence, whereas sometimes paraprofessionals, family members, community members are spot on with what they're saying because they've really been with that person. They know that family really well, and we need to listen to them. Sometimes why we don't listen to family, to paraprofessionals, is that they can create the potential to overlook. It creates the potential to overlook new evidence that might challenge the original narrative. So if we've got a view, then that's our view, and we don't want it challenged because it's complex enough. The interesting thing is that there can also be a hierarchy within families, with adults being listened to more than children, and the views of mothers being privileged over the views of children and fathers. So the question we have to ask ourselves is, who am I listening to and why? And are there other people we ought to be listening to that have actually got some really useful and helpful information and knowledge that will assist us in our work? And then back to those two themes that I think are in danger of becoming a bit meaningless buzzwords, but so we have to make them meaningful. The first is professional challenge. Now, you are continually exhorted to challenge one another, and I think the first time I really remember reading about that in depth was in the 2003 Victoria Climbié inquiry, Herbert Lehman's inquiry, when he said, I think it was recommendation 38, social workers need to have confidence to challenge their colleagues in other agencies. And, you know, in 2020, 2021, we're still saying these same things, that people need to challenge one another. So lots of exhortations, but I think sometimes we are not helped to see what the meaning of that challenge is. And here's a definition. So effective challenge is about exploring, questioning, seeking to understand the position of the other and opening up discussion in order to arrive at a well thought out decision as to the best way forward. So I give you that as a definition to help us with this issue of professional challenge. And then there are some factors that inhibit professional challenge. We need to really understand these, as well as some factors that facilitate professional challenge. So what can inhibit? And here are a few of the things, not an exhaustive list of things that can inhibit. Firstly, a lack of confidence, a fear of being wrong. Oh, if they're saying that, they must be right and it's me that's got it wrong. So that lack of confidence, so we don't even begin to question or say, is there another way? A fear of damaging working relationships, because some people don't receive challenge very well. It makes them defensive, and it can actually impact on working relationships. There might be the reputational authority of other professionals, and by that I mean that some seen as they're the expert in that field, so they must always be right, and you know what they say takes precedence, as it were. So reputational authority. Organisational hierarchies. It's very difficult to challenge upwards to senior people, so they can get in the way, they can inhibit challenge. And then there might be a lack of knowledge of processes and procedures. How do I challenge this? How do I question this? Just not knowing how to do it, who to talk to. So those are some of the inhibitors. What can facilitate appropriate professional challenge are good working relationships, where you're having a conversation with somebody outside of specific situations. You've got ongoing good working relationships. And then a professional culture that provides opportunities for discussion and reflection. That's not easy in the current climate of not being able to meet face to face, but we still can do that. And we need to find ways of doing it and building that culture. Clear processes, so I know how I can question, how I can discuss something. And then an organisational culture where appropriate challenge and a constructive challenge, and that's an important word, is the norm. So it's saying that, you know, this is what we do. We are able to constructively challenge others, but we also can receive constructive challenge, and that helps us to think through what we are doing and to be more effective in what we do. Professional curiosity. That's been keeps popping up, doesn't it? Over the last few years. And again, I think, what is it? We need to actually start from the beginning and say, what do we mean by professional curiosity? So I've given you a short definition there. I think it's the capacity and the skill to explore and understand what is happening for individuals and within families, rather than making assumptions or accepting things at face value. So it's thinking, what else is going on here? I wonder why they're doing that. So it's noticing. It's noticing in a wider spectrum, and thinking about those why questions and seeing if you can follow some of that up with people. However, the important word there is capacity, and I know that for some of you, your workloads and the sheer volume of work is difficult sometimes to be curious. But we do know if we are professionally curious, our assessments will be more in depth because we'll have a greater understanding of an individual and their situation, and therefore interventions and service provision will be more suited to that situation and therefore more effective. But as with professional challenge, there are factors which inhibit our professional curiosity and there are factors which promote it. So just a question to hold on to. We'll come back to this in the seminars. What stops you from being curious and what helps? The last theme that came up, and again, this does come up in lots and lots and lots of reviews, is the importance of supervision. Because good supervision is crucial because it provides those four things. It provides management oversight, it develops high standards of professional practice, and it identifies poor practice at an early stage. So if it's really rigorous and really exploring with someone what they do and what they are doing, it can stop poor practice and help people to see there is a different and better way of doing something. It provides an opportunity for thinking, for reflection, and for sense making. And I call supervision often as that a reflective space. So somewhere we can just come and do that thinking, because sometimes we're so busy, it's difficult to also do some clear thinking, and supervision should provide that, and hopefully it does. And finally, if it's really going well, then supervision supports and it motivates staff. And people do need to be motivated because this is difficult work that you're doing, and sometimes it can feel relentless. So it's about motivating staff to keep on going. You're feeling a bit depressed after that litany of shortcomings, but actually do bear in mind that through all of those reviews that I looked at, there was a lot of good practice, and you know, people really working hard and helping to make changes in somebody's situation. So I looked at what promotes effective practice, and there were some key components that came out. When you looked at particular examples, this is what was underpinning them, these four key themes. And the first one was the commitment and the tenacity of the professionals involved with individuals and families. And what I mean by tenacity is that sticking power, just staying on in there and keeping going alongside that commitment. The second one was building relationships. Building relationships and rapport with individuals, with families, but also with other professionals. So that relational approach to the work that we do. The third one was multi-agency meetings, providing an opportunity to come together, to discuss, to think, to reflect. And as I said earlier, not easy in current times, but we need to find ways to continue to do that. I am reminded of learning events that I've done when I have done child practice reviews or adult practice reviews, and often the comment is people saying this is so good to sit together and talk about this, and if only I'd known some of these things at the time, I might have done it differently. So just the power of coming together and thinking together and bringing all that expertise together. And finally, good recording. And recording that will stand the test of time. So think about those boundaries that were crossed when sometimes information was lost, but meaning was lost. So recording that stands the test of time and makes clear the causes for concern, the work being undertaken, and why that work is being undertaken. So those four things can promote and assist effective practice and intervention. But finally, as I finish this presentation, let me remind you again, something that you really do know. Working with human beings is challenging, because of the complexities of their lives. So what we can do is strive to keep learning and to keep developing our practice and our service in order to meet the needs of a diverse population. So thank you, and I look forward to meeting you later at the seminars.